Once again, Mombasa County finds itself in the limelight after 12 new cases of Covid-19 were confirmed from the county, with Nairobi remaining the county with the highest number of Covid-19 infections in the country, reporting 5 new cases.
From the samples collected today, we have 17 persons who have tested positive for coronavirus disease. This therefore brings the total of confirmed cases in the country to 320 cases. All the 7 are Kenyans, 12 from Mombasa, 5 from, all the 17 are Kenyans, 12 from Mombasa, 5 from Nairobi. 15 of these were picked by our surveillance teams, and it is important to emphasize the fact that they were picked by our surveillance teams means that these people were living within our communities.
According to Dr. Mercy Mwangangi, the Chief Administrative Secretary in the Ministry of Health, this is not time for Kenyans to blame each other over the spread of the virus, but rather time to show support to those who have recovered from the pandemic, as well as those who are in isolation.
We therefore must urge you, fellow Kenyans, to join us in ensuring that we do not stigmatize those who are sent to quarantine facilities and even those who have recovered from this disease. As we have always stated, if we continue to work together as one people and one nation, we shall be able to overcome this pandemic.
However, despite the number of recoveries increasing, it is still not clear who will foot the resultant medical bill, with the government seemingly yet to establish the cost of treatment per patient. Health officials also remain non-committal on the next course of action, with no set timelines for measures taken to curtail the spread of the virus, including travel restriction, as well as the countrywide dusk to dawn curfew.
Concerning the issue of cost and bills that are emerging from the coronavirus response at hospital level, again, this is an issue that has come to light. We currently actually are having a database that is looking at the different billing data, both in public and private facilities. And when negotiations and engagements with the different players to be able to define a mechanism that would be adequate in ensuring that Kenyans who may not be able to meet these bills would have those taken care of.
The government, now having established that the number of new cases being reported is as a result of community transmission, they're now calling on essential service providers to heighten their preparedness. Jimmy Mbogo, K24, Evening Edition.